Hello, I'm Dr. Richard Okoye, the president of Dr. Save a Life Foundation. I have a burden as well as a good news to share with you. Recently, I had a dream, very horrifying dream I want to tell you. I saw tens of thousands of women in an open field, most of them carrying tray filled up with fibroid on their head. Some were carrying on a plate and raised it up this way. Some were bleeding in pain. In the burden of the same, I suddenly woke up. On the basis of that, Dr. Save a Life Foundation is today rolling out a program, Operation Eradication of Fibroid Ignorance among our women, with the free sponsorship of 50 poor ladies that may have fibroid, but because of no money, we want to sponsor 50 of them anywhere they are in the country. Most worrisome, women are more conscious of their looks, their beauty, aesthetic, but they can't imagine what's going on, whereby a lady could allow herself, by reason of any form of deception, to carry fibroid like the size of pregnancy. Can you have a look at this? If people see them, they will say, God bless you, congratulations, whereas they are carrying fibroids. What can you say about that? Of course, you will not be wondering what must have kept them in such bondage. We have been able to identify 3 fundamental causes of this kind of frustration. Number one is that today we have a lot of spiritual merchants telling this one that their problem is spiritual, they will die if otherwise, and on the basis of that, most of them live in fear. The second generation are completely ignorant of the subject of fibroid, and that's why they become victim to all kinds of manipulation and drinks of all sorts. The last group desire to take the fibroid off, but there's no money. And that's where Dr. Save a Life Foundation is coming in right now to sponsor 50 indigent ladies to be freed from this very bondage of fibroid. And you know what? You can become part of this by just simple thing. You don't have anything to pay for it. All what you do is to watch this video based on the knowledge right there. Few simple questions you can answer. Submit your answers as well as your contact details. It will come to all be reviewed and you'll be reached. Above all, I want to beckon on you to think together with Dr. Save a Life Foundation to liberate our women from this level of ignorance in our society. Share this video to everyone you know. By so doing, we can protect the womb of our generation, the women God has given us.
I would encourage you to watch this video and answer the questions and submit your answers and contact details so that we'll be able to reach you to info@drsavealife.org or visit our website, and together we can save our women from this medical calamity. God bless you, and let's hear from you.
I have a strong burden to share something with you with respect to the deception our women have suffered because of the issue of fibroid. Something actually made me to prepare this video, not just because of people that are already victim to this particular thing I'm to share today, but for you to be in position, having a sister, friends, loved ones, for us to form a unit, to be in position to rescue them from the hands of manipulators. A lady last week lost her life. Very promising, very pretty, very promising lady. And what was it? She had fibroid. And this very fibroid, according to the sister's report, every month she used to bleed, and sometimes she will bleed and faint. But not just that this young lady didn't desire to get this thing out of her body. There happened to be a prophecy. According to them, one prophet around them was telling them that the problem is a spiritual manipulation, that if they go to hospital, she will die. And she was kept in that state bleeding every month, drinking all manner of things they were given to her, until she came to a point where she bled last week. She bled and got so weak that she couldn't get up. While they were there making all manner of things just to help her out, preparing punky and all that, that very lady could not continue. And before they brought her to hospital, she was stone dead. When I saw this situation, I couldn't contain it. How long can we allow such to be happening in our society because of ignorance? And today I want to expose certain things to you. Hear me. One unique thing you should know about a woman's menses. Correct. Unique thing you need to know about a woman's menses is that menses has a character. It does not form clots. I will tell you. Menses flows like water. To help you understand, it doesn't come in block of blood, because it has a fibrogenic component that enables it to liquefy. On that particular note, whenever you see yourself as a woman, you see yourself bleeding, and you watch your menses, and your menses is coming in lumps of blood, you are no longer menstruating. At that point in time, you are shedding your own blood. And don't forget, it is your blood your heart needs to keep you going. It is your blood that will circulate oxygen, circulate glucose to the entire body system. And what killed that very lady, I will tell you, no Satan was involved. And she was bleeding and bleeding. A time came that the heart was not able to contain it. The heart couldn't carry it. And that's why some of them, because of excessive bleeding, if they make a small movement, sometimes they feel dizzy. Come on. What is happening is that there's no oxygen getting to the brain, and you will just feel dizzy at that very point in time. Over the time, as the heart couldn't continue, she may go into what is called anemic heart failure. Anemic heart failure, sometimes the leg may start getting swollen. If she walks a distance, she gets so tired. She gets so tired. This used to be very active young girl, but she will be very, very weak. You know what is happening? Death was knocking on the door and looking for someone that will go and rescue them. I'm telling you, as I'm talking to you right now, there are a lot of our ladies under that manipulation, who will be told, if you go to hospital, you will die. If you go to a theater, you will not come out. Who is putting that fear? Devil himself. Not any prophet, I tell you. That if you go to, is that devil resident in the hospital? It is time for us to together, by reason of knowledge. You will all have these ladies. They are weak people. They are more emotional. They can easily believe anything. And at that point in time, I want you to help her. Share the knowledge to everyone. Do you know what they usually tell them? They will tell them, number one, it's a spiritual problem. Second one, they will tell, if you do surgery, you will not be able to achieve pregnancy. Life from the pit of hell. Come on, my friend. You can perfectly do fibroid operation and still have all your children. Thousands of women have done fibroid operation. They are mother of children today. But do you know what happened? We are deceived to feel that the issue that has to do with fertility is just a one gender issue. That is traditional ignorance we inherited. It's a misconception. Why did I say so? A man with low sperm count, as a matter of fact, most of the 10 years, 15 years, 20 years marriage without a child, it may be because the man had low sperm count. Maybe after 5 years of marriage, fibroid will not start coming. They will not hold fibroid. When the fibroid was not there, why was the pregnancy? So whether they remove fibroid 10 times, the woman may not be in position to achieve pregnancy. That is the correct truth. That is an undeniable fact. Another thing also is that some of them will leave the fibroid, as you saw in the one I presented to you, very big. And when this fibroid become very big, what will happen? Think about it. It was distorted the architecture of the womb, that by the time they take the fibroid out, it is almost over. That's why I want to encourage you, take off that fibroid at the right time. It can be professionally removed, and you will be able to have your children. But you know what? They will say, oh, Dr. Richard Okoye is talking because he's a doctor. He doesn't know there is one drug, one supplement or something that you will use, and that fibroid you will not go for operation. Listen to me and listen good. With all sincerity or purpose and heart for you, I'm speaking right now. Listen and listen good. There is no known drug. No known drug. Even the drugs that could be in position to shrink fibroid that are called gonadotrophin releasing hormone analogs, you can get them in the market. Lupron, Goserelin, and all the rest, Zolades. But should I tell you, these drugs can only shrink this very fibroid. Maybe if taking this injection for 6 months, but it can take you into the early menopause. That is for sure. Be that as it may, some will say, no, that this very supplement, that this very one, some will just be in position to do a manner of manipulation. I beckon on you, do not allow anybody to insert anything into your vagina on the course of treating you for fibroid. A young lady became a victim of that. She went and opened her leg and she packed all the nonsense after molesting her. What happened? Terrible infection. The vagina got closed. Every day she'll be having pain secondary to menses. Menses won't come out. She will be living in pain, and the intercourse was zero. Marriage is in crisis. We can't afford to allow such to continue in our society. We have to be in position to deliver our people from that. Then let me give you an acid test. Somebody will tell you, no. I tell you, you can know whether you have fibroid. It's not hidden. It's not the spirit. Go and do a pelvic scan first. Do a pelvic scan. Look at the size of the fibroid. Look at whether you have fibroid. What are their locations? Whatever anybody tells you, I beat my chest to tell you, go and take it for 1 month. After taking it for 1 month, wisdom demands. Don't be stupid. Wisdom demands you go back to check before and after your treatment. Is it working for you? It's not what the fellow may be telling you. Go back again and do a scan. If you do a scan and the fibroids are still there staring at you, can't you understand? Can't you understand that you don't need a prophet to be told you are being deceived? I put it to you, in the current dispensation, there is only one way you can take fibroid out of your womb and take it at the right time, and that has to do with the issue of surgery. Honest truth, I will tell you. You can do fibroid operation either by open surgery. Even today, the item can help you be able to remove fibroid without losing blood. And at the end of the day, the womb can be made sound and fine. Practically possible today. You can also do the one that is called laparoscopic myectomy, that you can be in position to use a camera and take them off. You could be in position to do the hysteroscopic myectomy, and so many of these. By and by, the essence of this is that wherever you are, get to the hospital, discuss with your doctor. Start from the known before you go for the unknown. Don't wait there until they do you part by reason of deception. And I want to encourage you today, take a step out. Quicken our loved ones wherever they are, out to get to the hospital and be attended to. Affliction shall not rise the second time, not when we know. I want you to join Dr. Save a Life Foundation in our vision 2025. That by the year 2025, Nigerian life expectancy that is currently 55 years will hit 70 years by 2025. It is practically possible by the power of knowledge. God bless you as you share this video to save someone.